Hi there, this is Paula Nutting, your musculoskeletal therapist, and I'm very, very excited that today's podcast I have got Albert Einstein with me. Oh, hang on. No, it's James Waslaski, not Albert. This must be his, third cousin, fourth great-grandchild?
Somewhere down in the generation of Einstein look, actually.
Yeah. James, tell us your story. 30 years in the industry.
Yeah, Paula, I got into this in 1990. I was a paramedic firefighter for 20 years before I got into massage. And the blessing of that background is I taught paramedic firefighting at colleges and universities. This is part of my life that people don't even know about.
No.
So as a paramedic firefighter, teaching at universities about, ACLS courses and advanced medical courses. And I worked in a trauma center for maybe 10 of those years where we would see high-level trauma patients. And so that background got me into massage. I actually took it for a hobby. I was a paramedic firefighter. But then I met people like Benny Vaughn who just turned me on fire about sports massage, and I started to study with some of the legends and the masters. So for the last 30 years, I've never gone a year without studying the who's who of the industry of massage therapy. So with my science degree in college, my 20 years as a paramedic firefighter, it really set the foundation, Paula, of what I wanted to do from a clinical perspective, from a structural perspective, from a prevention of surgery perspective. So it's been an amazing journey, actually.
That is amazing. And you talk about Benny Vaughan. Did you listen to the Thinking Practitioner, which is Till Lukow and Whitney? They had him interviewed. What an amazing human being.
Benny and I only live 20 minutes apart. He's literally 20 minutes from. We were both from Florida trained therapists. We both moved to Fort Worth, Texas. He's literally a 20-minute drive. So I've been to his clinic a few times during the last 6 montechs, just to kind of, and we talk about masterminding, which is something we'll talk about later in the
Yeah, I'd love to hear.
Bringing together integrated manual therapy techniques.
So you started, like we all did, as a massage therapist, doing massage through your clinical studies in the college in the States. When did you go, I'm going to start presenting and teaching what I know? How did that evolve?
What was what?
How did that evolve? How did it go from I'm a practitioner to I'm going to teach the work?
So when I got into massage, I'm very athletic. I used to do triathlons. I'm still very athletic. I still bike 2 hours a day during this time. But what I wanted to do was work with professional athletes, Olympic athletes. I wanted to work the Olympic Games. I actually taught at the Olympic Training Center in Australia prior to the Sydney Olympic Games. So my goals out of massage therapy was to find the leaders and the mentors and the masters in the field of sports massage. Benny Vaughn was one of those people. So I set my goals, and as a paramedic firefighter, my chief of the paramedic of the fire department didn't want me moving into another profession. So he made it really difficult for me. So right before the 1996 Olympics, which was my goal, and I was accepted to work with gymnastics and track and field, my captain said, I'm not going to give you the time off. So I quit. I just quit, went cold turkey full-time into massage. So I just quit that day. I resigned after 20 years as a paramedic because he wouldn't let me go to the Olympics. And I was chosen by Benny Vaughn to work the Atlanta Olympic Games in 1996. So it really, sometimes those bumps in the road, like some of the things really just push people to their divine potential. I mean, it's been a journey that's been sometimes bumpy and then sometimes really amazing.
Yeah. What did you first start teaching?
This is interesting. So I was a student in 1990, and Michael McGillicuddy, was one of the leaders in the sports massage world. He was the chair of the AMTA National Sports Massage Sports Certification. He was my instructor, Michael Pagani, I think it was his name. And he was like Benny Vaughn, kind of the legends of sports massage, but he got sick a week before the Florida State Massage Therapy Association conference. Now, I'm a student, but I'm an athlete, so he said, can you fill in with me? So I literally taught my first class at one of the biggest major conferences in the United States, Aaron Mattis was in my class, and somebody asked to stretch about soleus or kinetic, and I said, well, Aaron's here. You ask him, because I really didn't know what I know now. And Aaron's going, he said, young man, you've got really great potential, but you need to step up your game. You need to learn more about this. So in many ways, I literally started teaching, because I was teaching universities and colleges for 20 years prior as a paramedic instructor. So I was a teacher since I was a paramedic when I was 16. I was teaching when I was 17. So teaching is really my passion, doing the job I love. but teaching is what I love the most. So I've been teaching my whole life, but I was teaching literally classes right out of Musculoskeletal school. I think in 1995, I started international stuff in Scotland and Ireland through connections with Dr. Tiffany Fields and leaders of our profession. They hooked me up with people, osteopaths in other countries. So it's been just a nice progressive journey where now I'm teaching in 15 countries globally around the world. And
Yeah.
I've moved on.
Although not right now.
Not right now. Now, I was shut down March 12th. I was in Hawaii on March 12th.
Oh.
And they called me and go, well, AMTA is canceling the next 12 weekend conferences that you were scheduled to teach in 12 different states. And so it was like, when that happened, I had called my pastor and said, I'm kind of depressed right now. This is my love. This is my passion. This is what I love. They said, I don't want to bring this back to my wife and daughter. I don't want to bring this, oh my God, what am I going to do now? Feeling bad. So my pastor kind of walked me through some things to do to just get back on track emotionally, energetically, and I just hit the ground flying to get caught up in projects that I've been putting off for the last 30 years.
Yeah. And if you're listening to this currently, anyone out there who is still feeling that there's depression, that we all urge you that the people who, you can come from any walk of life and still feel that you need help. So reach out and talk to someone, a mentor, anyone that you can feel that you can actually really reach that understands you. So it's really, really important right now if you're currently in COVID and currently feeling the effects of it at that deep emotional level. James, I've seen you teach a few times, AMTA and Massage and Myotherapy Australia, and helped you here. And I see your passion. It's almost tangible. You can feel your passion. Right now, you're doing something about the shoulder. Clinical studies, capsule work, things like that. Can you fill us in a bit more on that for the people who are listening?
The timing's perfect, Paula, because you just interviewed John Sharkey, correct?
Yeah.
So an interesting study. John did a paper in a study on frozen shoulders. I don't know if he talked about this.
No.
His paper was posted, and I looked at the paper, and he said most people who have frozen shoulders, those shoulders that move like this, actually, when he dissected them, because he was an anatomist for 22 years, and he would dissect every frozen shoulder that was diagnosed when they're alive, when they're passed away. And he found, Paula, something that totally changes the way I treat these shoulders. He found that most of them didn't have true frozen shoulders. Most of them had scars. So say a rotator cuff tear scar, which was gluing down the humeral head, say a pec minor scar, strained muscle fibers, abnormal scar tissue. So most of these patients over the 20 years of dissecting frozen shoulders had the same assessment outcomes as true frozen shoulders.
Yeah.
And he found that if we could treat the scars and reduce the secondary muscle guarding and calm down the central nervous system and get you out of that fight or flight mode. So even when I taught the class you were at, 5-6 months ago, Paula, in Australia, I've changed the protocol tremendously on how I treat the scars, the secondary muscle guarding, the upregulated central nervous system, the getting people out of sympathetic stress into parasympathetic mode. Yeah. So even in the last 6 months, it's totally thanks to the work of the studies and the clinical papers of John Sharkey. Yeah. We're now looking at positional release techniques more. We're looking at gentle rocking trigger movements to calm down the nervous system. We're looking at the dolphin MPS microcurrent to calm down, get you out of fight or flight mode. And then just another brief story. In October, I was asked by a real high-profile family in Kuwait to come out, and the lady's surgeon asked me if I could come out to treat her frozen shoulder. So he diagnosed her with that. So I get there, and she can move her shoulder like this, right? And I did everything I know just to the shoulder. And I only got her to here, which I'm a perfectionist. I was very unhappy.
She would have been stoked, though.
But I went back that night, and I processed, and then I looked. I had just studied with Dr. Carrie D'Ambrosia, a brilliant osteopath that taught me total body balancing. So I went back the next day. I looked at her ankles. She pronated 1 foot, supinated 1 foot. She had bilateral tibial torsion. She had an iliosacral torsion. She had a scoliosis. She had spinal stenosis. So when she raised her arm, the nerve pain when she did her arm. So I came up with a new program. Now I do total body balancing always first. I treat all the scars first. And then after all the other joint function is restored. So think about my hip replacement. The scar would be pulling me to my hip. My shoulder injury from mountain biking scar. So she had so many pre-existing conditions that if we didn't look at the total body, every joint function, every muscle and balance position. So I went through the total body and balanced out everything except her shoulder. Yeah. Then what I did is there's a protocol, and I'll just bring these on later in the interview, but there's the dolphin MPS microcurrent.
Okay.
So what I've done with microcurrent, which is very different than alternating current. This is DC current, microcurrent. So there's a protocol for frozen shoulders and rotator cuff tears. I did that work on her shoulder. Immediately, that the scar tissue became more malleable from the supraspinatus tear she had many years ago. The humeral head dropped. Mm-hmm. The range of motion was complete. So by looking, and so I've decided, the doctor in Kuwait said, Jim, can you come back and teach? I'm supposed to be there this September. 300 surgeons coming from across the globe. Wow. So he said, can you come back and teach these 300 surgeons prehab, rehab, shoulder prevention? He said, they're not treating the scars properly. They're not treating the secondary muscle guarding. Our manual therapists aren't doing good manual therapy in the field of prevention and rehab. So I'm still scheduled. I don't know if it'll happen or not, to speak with 300 surgeons who are coming across the globe that all specializes in shoulder surgeries to prevent these surgeries. His patient had full range of motion at the end. We prevented the surgery, and he said, we need you teaching our doctors. So I came up with a new DVD that gets into total body balancing, scar tissue release, down regulating the upregulated sympathetic nervous system to get you out of fight or flight and secondary muscle guarding. And thanks to John Sharkey that you interviewed, I'm now doing more position release, finding positions of comfort, calming down the brain, reducing secondary muscle guarding. And so it completely transformed the way I would ever look at a shoulder.
Yeah, that's amazing. You know, there's a couple of things. One is that there's a lot of people out there that don't believe you can do anything to scars. They go, it's impossible to do treatment on scar tissue. And clearly, that's rubbish.
Well, back in the days, what we used to do, if you had a muscle strain, is we would do deep cross fiber friction back in the days.
The old Styriax, wasn't it?
Exactly. But that is becoming outdated now because of the new research on getting to the scar at a cellular level. Susan Chappelle talked about scar tissue remodeling. In fact, if I could share briefly if I could share the screen and just show them my scar from my hip replacement. And I want to show you between the DC current of the dolphin neurostim and the myofascial cupping techniques that you almost cannot see a cosmetic scar 3 weeks post-surgically.
I'd love to see that. 3 weeks
post-surgically with a full hip replacement, I was teaching 90 people in Kentucky AMTA conference, hands-on therapy, no cane, no walker, no pain meds. And this is the evolution of scar tissue. It's pretty brilliant. Do you want to see?
Yeah, I'd love to. So, do we have to share screens?
I'll just share screens for a second. I don't think your host can.
I think I can. Share screen. I can share my screen with you. No, it's the other way around.
Okay, so let me see if that's right. If we can't do it, I think your screen's up there. Your computer's up there. But if it's a difficult thing, I just wanted them to see the difference of what we can do, the scars, and I've got photographs of it.
Yeah, I definitely want to do that. I'm just trying to work out how I mucked that up so beautifully.
We can go back to screen share, see what happens. Disable the attendee screen sharing. Sorry, guys, bit of a glitch with the. We can try to do it at the end too, Paula. I'm
just trying to work out why I've gotten us down into really small without being able to unshare. There's the controls again. Stop share. Okay, so do you want to try sharing your end?
Let me go back to that, and here we go. So I'm hitting share screen. Usually if I run it from my end, I can do it, but
perfect.
That's all right. So anyway, the scar was like, you've seen the scar from a hip replacement. It's pretty nasty looking.
Oh yeah, I've got one.
And between the DC current, both prehab and rehab, before surgery and after surgery, and the myofascial cupping, it's a pencil line. So now I'm doing everything I did when I was in my 20s. I'm doing workouts in the gym. I mean, I forget what hip was replaced. That's how amazing the combination of the myofascial cupping, which is an anti-inflammatory, antioxidant, neuromodulator, the dolphin neurostim. Literally, I tore my supraspinatus tendon, so I have a secondary tear. But with that treatment and followed by certain exercises, now I have, well, this was like a few months ago. I mean, the evolution of what we can do at a cellular level to make the scar more malleable, increase ATP, increase functionality of the scar is so far beyond the old Styriax frictioning, concentric and eccentric muscle contraction. And this has all been new for me just in the last year, which is pretty
Yes. So if therapists are listening to this that don't have access to the dolphin stim, They can still do positional release to get some kind of work.
Yes, you know, based on Jones counterstrain positional release. And what I do is I find a position of the body where the ligaments are relaxed, the joints are relaxed, the nerves are relaxed. And then I add some gentle rocking so that they kind of let go of the secondary muscle guarding, which gets back to John Sharkey's research, not research, clinical study paper, anatomist. But he said calming down that brain lets them take that deep breath. And so the work I do is so much gentler, so much neural, so much more dealing with the neuroplasticity and the unconscious fear and the guarding now.
Yeah.
It's so much gentler.
So students that are out there that have only just recently come in or been less than 5 years in the industry, you tend to be really heavy-handed. I want you to listen to this man because he's 100% on the money. You talk to therapists that have been in the industry for a long time and we become more and more gentle, not more and more hard. It's the nervous system is our greatest utilization of how we can make huge changes, and we don't want to be doing hard stuff. You're also doing capsule. When I saw you were doing a lot of positional release, calming, and capsular, compression.
So one of the things, if you think of the hip, there's the ilium and then there's the femoral head, right? And there's a capsule that surround it. But think about my hip surgery and those scars of the muscles they cut, right? So instead of doing what we did before, where we would just go in and do this little mortar and pestle thing, we've totally changed that. Now what we do, Paula, is we just find that position where the scars are relaxed, the ligaments are relaxed, the joints relaxed, the capsules relaxed, and then we do a little rocking, and the patient just goes. Oh. And that allows us to gently stretch the capsule and reorganize the scar. So if we combine the positional release of joints, ligaments, and we also do things where if they have SI joint pains like an iliosacral torsion, we relax ligaments and we stretch ligaments. And that mild, gentle work allows us to correct things like that. Yeah. So it's so much. I used to be heavy-handed when I got in this profession. When I taught in Australia at the Olympic Training Center for Sports Massage prior to the Sydney Olympics, I was still getting into the piriformis with my elbow. I was still doing things I so regret. The wisdom and the knowledge and the expertise and the results that I'm getting now with letting the brain feel safe.
Yeah.
It totally changed everything.
Didn't we do some horrible things back then?
I know. Just make it happen. It's all about our ego and our agenda. And it's like, they're just going to beat you up. And when the bruising's okay, it's not, though, because the brain, as soon as that brain feels where it has to guard, you really can't get beat.
So I can hear therapists out there right now saying, hang on, James, what about my patient or my client that is one of those no pain, no gain people? How am I going to convince them to do something soft?
You know, Paula, if I can tell you that if I release rectus abdominis and the obliques and slowly get into your psoas and you're not tapping out on my massage table, you are actually going to be so calm from a central nervous system perspective that you're going to let me get in slower and deeper. So the gentleness is, if you go to the pain science studies in San Diego, it'll talk about the brain is really everything. I mean, so when we add stress, pain goes up. When we add guarding, pain goes up. When we add fear, pain goes up. So if we don't calm down the central nervous system and make the brain feel safe, and even Whitney Lowe, who you interviewed, what we say, Paula, is totally changing the way the brain is processing that information. Those positive healing conversations we're having about relaxing, letting go, feeling safe emotionally, safe from the post-traumatic stress, safe from prior life experiences. So rather than working on the body, I'm working with the brain's faith, trust, processing. Every thought we give energy to transfuses to every cell of the human body to the level of changing our DNA. So what thoughts are we putting in with the techniques? Eric Dalton talks about this a lot. He talks about how the brain has to be regulating every manual therapy technique we do. And by being gentler, the brain feels safer and it's more likely to be calmer. Traeger had something, that rocking. They calm down, they just let go and lets you facilitate the body's innate wisdom to heal itself. Yeah,
no, that's fantastic. It's great James. And that's people have done my course, the same thing. Chapman's reflex is all about working the neurolymphatic, but we start at the brain and we start at the vagus system.
I'm looking forward to taking a course with you sometime. I would like to learn more.
Yeah, it would be a pleasure.
I want this piece and that piece and this next piece.
I know we want to grab jigsaw puzzles, pieces from 1,000 jigsaw puzzles and put them all together to be the one for us. Talk to me about kinetic chain patterns, because you've made that comment a couple of times.
So every joint affects every other joint. So I'm going to break it down into simple pieces for the new therapist. There's joints that are held together by ligaments, and there's a way to calm down. In fact, Robert Libby teaches all about ligaments. He just gave me his book to review. I'm spending hours and hours and hours right now to review a book he's going to get out on ligament work, coming out in about a month. So I'm going to learn a lot about ligaments again. But what I'm finding is we've got the bones, the ligaments, we've got the soft tissue, we've got the scars, and we've got the nerves. And so what I do, Paula, is I kind of look at integrating all of that. So feeding off your question again, I just got off on a tangent. Your question was...
The question was, explain to the students what kinetic chain patterns are and how they can utilize them.
So I'll reference, I learned this from combining Eric Dalton's work in Musculoskeletal alignment with Carrie D'Ambrosia, who's an osteopath in Canada, in the US, acupuncture physician. Carrie D'Ambrosia from the D'Ambrosia Institute taught me total body lymphatic drainage over 4 days and introduced me to total body balancing. So when I think of kinetic chain, Paula, if your foot overpronates, your tibia rotates medial, right? Which causes knee pain. And then that causes the femur to compensate, that causes the ilium to compensate, that causes rotoscoliosis of the lumbar spine, that causes kyphosis, that brings the neck forward. And now we're treating the OA joint because you have a migraine headache. It's not possible, because as soon as you get off our table, it all comes back, right?
Yeah.
So when I was in Kuwait, and they paid me good money, flew me an Emirates airline, put me up at a 5-star hotel. They really took care of me out there. If I hadn't learned total body balancing and kinetic chain work, I would have never released that lady's shoulders. Literally impossible. Yeah. So I get there, and one foot's overpronated, one's supinated, total different treatment. One tibia is laterally rotated, one's medially rotated. One ilium's anteriorly, posteriorly rotated. So there's a right anterior rotation, left ilium rotation, posterior, which caused this lumbar spine to twist, which caused ascending scoliosis, which caused her neck to come forward, which then dropped her rib, her clavicle under her first rib, which caused the numbness in her arm. Add a second-degree tear of her supraspinatus, which would cause the humeral head not to be able to drop from the acromion. So it caused this motion. If I had just treated the shoulder like I did for many years of my practice, I would have not gotten, one, I wouldn't have gotten great results, and two, I wouldn't have gotten lasting results, because as soon as you get off the table and went from open kinetic chain to closed kinetic chain, all of those problems have come back because of the foot problem. So by not looking at, so I can go through all the joints in the body in 5 to 10 minutes. And that's the first thing I do.
That's my next question.
Look at your ankles, how's the talus doing, how's the calcaneus doing, is there fibular head glide? I check for common patterns like tibial torsion. When you drive your car, the tibia rotates around the femur. I check for common patterns like anterior, left, posterior rotated iliums. I do muscle energy work and correct those. I move up into clavicular rib space and clear out the nervous system. I down-regulate the nervous system by treating every scar you've had since you were a little kid. And then what that does is all those scars since you're a little kid pulls you to a different scar, right? Here's an example, Paula, on the scar thing. When I had a mountain biking accident 2 years ago, I had literally had 60 cactus pines surgically removed from my lower leg. My fibular nerve pain was a 9 out of 10 for months. 60 cactus pines. I had a second-degree tear of my supraspinatus, my rotator cuff, same mountain biking accident. Add that to my scar from my hip replacement. Add that to a scar I had when I was 5 years old in my right calf that was split open. So my body was pulled to all these myofascial scars, right? So the work that I learned from Eric Dalton didn't help. The work that I learned from all these legends and masters didn't. So Kelly Armstrong's text in the picture, and she's in my new DVD with me. She's an occupational therapist for 22 years, queen of scars, knows all the research on C-section scars, visible and non-visible scars. She treats all my scars. All of a sudden, I go back and get one treatment of some of these things I teach, and everything went away. My pain that I had for 3 months went from a 9 out of 10 for 3 months, nonstop, couldn't walk, had to be brought in by someone. I was carried by some of my teaching assistants. And as soon as all my scars were treated, all these things I'm talking about, total body balancing, mouse skull alignment, muscle balancing, were perfect. And this, for the last 6 months, I haven't had pain in one single part of my body. I'm 63 years old. I'm very active. I haven't had one inkling of pain, but that was a piece I was missing. I was missing the scar piece and the lymphatic piece and the skeletal pieces. And so when I was focusing so much on soft tissue, which is a lot of what massage therapists do, You know, my concern is, say you go to a PT and you have this rotator cuff injury and they force you to walk up a wall, or they do something that creates pain. They haven't gotten the tissues healthy enough, Paula, to allow you to do the exercises. The joints have to be healthy, the ligaments have to be healthy, the scars have to be healthy, the nerves have to be healthy. If you try to do an exercise when it's all scarred down or trapped by a bone or ligament or nerve, those exercises actually increase and upregulate the sympathetic nervous system, which increases guarding, which means the patients never get better. So I wouldn't go to, there are some great PTs out there, but I wouldn't go to the physios or the PTs that are doing old school exercises without good manual therapy techniques to get the joints, the ligaments, the nerves, and the scars healthy.
Yeah, wow. Can we, or have you got any tips that you can give for therapists out there that might have scars that can self-treat? Is there any tips that we can do for ourselves?
Absolutely. One of the books on MPS therapy, I mean, you can go in here and I'll just randomly, kidney problems. I had some kidney stones. I treated that with the MPS therapy. I have, you know, neuralgia things in here. You can literally go through this book and you can do programs like during the isolation, there's a high level of stress. And there's these neurostims actually find the acupuncture points electronically. They'll start beeping when you're out of the acupuncture points. So there's calming points. There's a way to get you out of fight or flight. There's ways to go around the scar and do 3 passes and treat the scar. Yeah. And I couldn't get my fingers into the scar of the supraspinatus because it's a non-visible scar. So this actually penetrates the microcurrent right under the acromion to change the ATP and the cellular makeup of those scars in the shoulder. So I had a 2nd-degree tear. My doctor wanted to do surgery. He wanted to immobilize me, which they shouldn't be doing for soft tissue injuries. No. And even the doctor in Kuwait who does the shoulder conference worldwide, he said the doctors across the world are immobilizing soft tissues, and they shouldn't be, because then you get nasty scars. Then you get scars that affect nerves and joint function, and all that adds up, and every scar adds up. And we're not talking about that C-section scar. We're not talking about the fact that every C-section down the road presents a shoulder, neck, and back pain. We're not talking about how that's limiting the lymphatic flow. We're not. So I'm teaching surgeons how to pre and post surgically treat scars. I had the microcurrent and the cupping done within 3 weeks post surgically, but I also had it done pre-surgically to calm down.
Oh, prehab, yeah.
So I'm really into prehab, rehab. Not a lot of patients are teaching 90 people hands-on therapy after a total hip replacement with no walker, no pain, and no pain. And that's the future of getting the scars healthy and the joints and ligaments healthy, because when you have a scar that's pulling your body in different directions over the years, structural body work is not effective. Yeah.
What does
20 years ago.
What does MPS stand for?
Micropoint stimulation. So it's microcurrent to stimulate trigger points, acupuncture points, to basically calm down, bring you out of sympathetic to parasympathetic mode. But why I got into it was because of all my scars from my mountain biking accident. I had Eric Dalton work on me. I had so many of my colleagues work on me, and it was temporary because I wasn't looking at that integrity model from my hip replacement and my injury when I was a little boy at 5 years old. I wasn't looking at all those fascial folds and scars. And that's just another piece of making me a better manual therapist. But it took my own experience and my skepticism about this being possible. Kelly tried to get me on her table for several years, and I said, no, until I was severely injured. And then I went, all right, I got carried over there, and I walked away with no pain. And I'm like, oh my God, why didn't I think of this? Why didn't I think about all these stuff?
That's incredible, isn't it? So for people who are in Australia, do they have access to that?
You can go to our website, and it'll link you right into the owner. I know the owner really well of the company. If they go to www.orthomassage.net, it'll link you into where we sell these machines, and then it'll link you into their information. And it's really good too for concussions and brain injuries and PST, because it actually affects the secondary scars that are happening from these brain injuries. So it's really, Paula, it's probably, I don't promote a lot of products. As I travel the world, I get asked to promote about 300 different products here, and I only promote 3. Yeah. I mean, I have a good electric table I use. I have pain reliever ointments that I use. I have this microcurrent that I use. Unless it really wows me, I'm not. Because I've been around the block for 30 years. I've met the legends of bodywork, and everybody's got this gadget or this thing that they say works. And I didn't believe it would work until I needed it on my own human body. So it's so interesting. They can go to our website and get information.
All right. So what was the link for the website again?
www.orthomassage, which is ORTHO massage.net.
.net.
And that gets into some of the products that we support and carry based on outcome. I don't sell stuff that,
Yeah.
I mean, 90% of what people ask me to sell, I don't promote because it's not outcome based. So.
Oh, that's incredible. So I always ask therapists that I'm talking to, and it's interesting how they respond, but what would this James Waslaski tell that young slip of a thing when he first got into this industry?
So I'm going to share some of my life experience. As a paramedic firefighter, I had a bit of a typical male ego, right? So two things changed that. One, being married for 20 years, our anniversary was 20 years last winter, with Fran. That changed my ego because she's a strong Italian woman. And I regret coming into this profession with a strong ego, thinking I know it all. I regret that so much. When I was young and knew nothing really back in the days. So I would say be humble. My other thing would be, if I look back at the years, that was my biggest regret, is getting my ego in my way of learning and improving and being a better human being and being a better practitioner. I would also say set goals. You know, every thought we give energy to is going to put you where you think. So I would say find colleagues like I've especially trained with for the last 20 years, colleagues like yourself, Paula, colleagues like John Sharkey, colleagues like Eric Dalton, Carrie D'Ambrosia, posturology experts, and train with them because they're masters of the world of manual therapy. What I've learned over the years, Paula, is that the more I know, the more I realize I don't. The more humble I become. When I sat into Eric Dalton's class the first time 12 years ago, I've taken his training 9 times now because I'm a slow learner. And now I'm a teaching assistant. I'm assisting him in September in Oklahoma. So I know about joints really well. I don't know if you know of Robert Libby, but he's a world leader in ligaments. So I literally bow down to these people and go, I want to know what you know. I want to know what you teach. I want to know what I don't know. I just took a 4-day lymphatic drainage course, and I was humbled because I knew nothing about long lever movements of the lymphatic system. I had studied a little bit of Bruno Chickley's work, and I knew about Vatter's work, but this just took it to a whole new level. And I was so humbled. I'm going, I don't know this yet. So at 63, I'm like craving to learn from every different mastermind. You look at it one way, I look at it a different way. Benny Vaughn looks at it a different way. Everybody sees the body different. Yeah. And I'm looking at combining spiritual healing, energetic healing, emotionally healing. I've been riding my bike an hour and a half to 2 hours for the last 90 days. That's my meditation time. That's my prayer time. I live in a beautiful nature center. I sit back there with my dog. I find this inner peace that I didn't have when my ego got in the way. And I think that I would tell them to seek out great masters and don't be afraid to ask. If I find a mentor and I go, I want to learn from that person, just like we're on this Zoom, you just called me up and said, I'm there. And you're finding that across the globe right now, leaders of our profession are becoming closer. We're becoming more integrated. We're becoming friendlier. We're becoming more interactive. We're getting to know people's life. Yeah. Enjoy the journey instead of the destination. You might get to the destination and you miss the whole life experience. Yeah. So I would say be humble. When I worked with the New York Yankees, who won 3 World Series in 96, 97, 98, I walked in there and the athletic trainer who's been training these athletes for 25 years goes, we don't like massage therapists. They have too much of an ego. And I was one of those guys back there. And I said, I'll buy you coffee. I'll watch you. I just want to follow you around like a little puppy and learn what you have to teach me. You've got 25 years, 3 Major League Baseball World Series titles. I want to watch what you do. So I would say be humble when you get an opportunity to be mentored by the masters. Be kind. Give little gifts out. Send them a little package. Thank you for not an email, not a phone call, not a text, but something simple to say, I really appreciate how you contributed to my ability to facilitate healing for people all over the world. And I would say that would be the younger me before the ego got in the way and delayed my career for years would say, just be humble about things. No matter how much you know or how much I know, Paula, someone's out there that knows way more than we know. Yes. And those are the people we should seek out and humbly say, I want to learn something to add to this great work with our
There's such beautiful words. So for you out there, if you're worrying about, well, what's my next step? How do I do that? go onto their Facebook page. Easy for anybody to. I jump on and looked up for. Yeah, and Dr. Perry Nicholson, he's another one that I interviewed. That he's like you, changing, evolving. Great chiropractor who's now doing lymphatic stuff and gut inflammatory work. So if you're passionate about something, go on their Facebook page, go into their Facebook groups, and just type in that comment box, ask questions, because people like James are more than happy to answer any questions.
You know, people from Australia, I went to Australia, I started in 1996. I proposed to my wife at the Sydney Opera House in Australia. People from Australia are such beautiful people, and what they probably see if they go to a conference like the conference that I did for AAMT, which is now changed, is that I'm out there on the dance floor and we're interacting and we're having fun. That's how we met. I mean, we're laughing, we're sharing ideas. That is just as important in our profession. Ashley Montague, an anthropologist who I had an opportunity to meet before he passed away, wrote the book on touch. He said, our industry is craving compassionate touch. Our industry is craving, until he was in his 80s, he would kiss his wife every day, he would dance and he would move. And he taught me that the research he did, which influenced Dr. Tiffany Field's Touch Research Institute, is that we need to share unconditional love with that touch. We need to be kind and gentle and compassionate. And the friendships like the one I have with you, Paula, is as important as the travels around, which is why I love the travels around. Yeah. You know, I hung out with David in Bali. In fact, we spent, this is a secret, but we spent Valentine's Day together in Bali. David.
You and David Sheehan.
I wanted them to know that about David Sheehan. So nothing going on. No, we both were. So, okay. But that friendship that I have learned with colleagues around the globe. I mean, I think I met you at one of the Canadian Massage conferences.
Yeah.
In Canada.
Yeah.
And David said, would you come out to teach? And I'm like, I was at your table just like, oh my God, this opportunity is so amazing. Yeah. You know, but I think I just love the people, the energy, the country. I want to come back. I know that your conference is full in 221, but I'm hoping and praying that I come back in 220 because I have so much new stuff. Yeah. Can I share one last thing, Paula?
I would love, please. Anything you can give us.
When this all happened, the coronavirus all happened, and my 22 back-to-back seminars got canceled, I was pretty overwhelmed. That's a nice way of saying I was actually very depressed.
Yeah.
But I called my pastor, got out of it, and just hit the ground flying. And I called up a company, a Better Together as One company, concept out of Canada. I'm just going to mention them briefly. It's cluster.com, and it's www.bettertogetheras1academy.com. www.bettertogetheras1academy.com. And I said, you know, people are putting up a lot of online courses, but they're just doing it real fast and real furious. So we've got this online course that's like online course on steroids. It's the newest DVD I just produced. I've never taught this anywhere in the world yet. This course, it's called Kinetic Chain Patterns and NPS Scar Release Therapy for Complicated Shoulder Conditions. It goes over way more than we talked about. This 3-hour CEU online course would be like training with me in the classroom for 3 full days. Because you're interacting, you're doing questions and answers, you're taking exams, you're going back and watching the review. Kelly Armstrong comes in and shows you how to treat the scars because she's the world leader, so I have her in my video. Yeah. But this online course we did with Better Together as One Academy is really, the university professors out there have been doing this for years. Fern has been doing this courses for doctors and everybody. She said, don't just throw something together. So we spent hundreds of hours. 3 months putting together a course where you can interact, you can be on the Zoom with me live and ask questions, and we're discounting it from the coronavirus, but those are what I'm doing with my vacation time, my last 3 months of vacation. Yeah. Updating handouts, getting new Zoom classes, getting really raising the bar so that if you and I know that our learners are kinesthetic, visual, and auditory. Yes. Personally, I can read a book and I can hear a lecture, but I comprehend almost zero. I need to feel the work. I need to see the work. I need to do the work. I need to interact with you as the educator and get that little tweak, that little, oh, that's too much, that's not enough. So I'm hoping that as if we do online courses, that they're not just thrown together just to make money and make things happen. I hope they're done with a high level of quality of this group did. But they just said to me, Jim, we've been trying to get you to do this for 3 years, but you've been too busy.
Now.
So what are we doing in this? I think God reset the world. I'm a spiritual person.
Yeah.
I think I have a chance to I said to Fran, I need more time to bite. I need more time to get my business built back up, because we're giving out handouts that are 10 years old. We're using PowerPoints that are outdated. And I said, and boom, it just happened just like that. I didn't think that was the reset button when it happened. But I tell you, I'm happier now. And my seminars are going to be better. When I go back to Australia, say in 2022, they're going to be a level beyond what you've ever seen in the country, because of the opportunity to not just go, I'm going to go home and be depressed, but the opportunity to have those 3 months that I was looking for to become a better spiritual human being, to become a better educator, to align with people like you that I've been doing on Zoom all over the world and get to know each other better. So I'm really blessed for this opportunity to do all these classes and interact with my colleagues.
Yeah, wow. And a take-home message for that, everybody, is that people who are doing online courses, because there's a plethora of terrible ones out there. Whitney said the same thing. Go into it a bit deeper. So you're doing live stream work with it. Mine a live stream. Just make sure that you've got more than just somebody who's chucked a PowerPoint presentation together and selling that on a package.
I agree, Paula. And Whitney Lowe was very instrumental in my leap to do it right. He said, don't just throw something out there. Yeah. And he called me. I mean, I was amazed how many of my colleagues I picked up the phone. I said, I'm not very good on the computer. I'm not very good at, now I have a studio in my home, a video production studio with lighting and sound. That's all happened in the last 3 months. So I'm probably been busier the last 3 months than when I was traveling 45 a weekend to Europe to 15 countries around the world. And I'm happier because I've had more quality time with my family, with my dog, with nature, with meditation, with just exercise. Yeah. I mean, I was pretty wiped out when I was traveling all these, Paula, you travel a fair amount, but I think 45 weekends a year is my minimum, and that's in 15 countries. So between the flights and the airports and the hotels, if it wasn't for the people and the love of the people that I've created worldwide, I don't think I'd be as passionate as I am about this. And don't be afraid to ask your teachers to talk like this, because we're not on a pedestal. We're equal to every therapist out there.
Yeah, we are not on a pedestal. And anybody out there who thinks they are on a pedestal, don't go near them. But always ask, because we are not on pedestals. I'm the first person on the planet that will happily stop what I'm doing to have a conversation, help somebody. And you as well. I've got to say, you are actually the calmest I think I've ever seen. Your cortisol levels are down.
Well, part of it is just the idea that I get an hour and a half to 2 hours every day to ride my bike in nature centers and around lakes. I have my TRX strapped. Our house is built on a 30-acre nature center, so our backyard looks like fishing ponds and jogging trails. I go out there every night. So when you're in hotels every weekend and you're in airports every weekend, Paula, it literally drains you. There's a book called Blue Mind I read, and it talks about the water and the nature and how it changes the chemicals of the brain. And so every day I've been out in my nature center with my dog every day in the last 90 days. It literally changes you at a brain cellular level. And so thanks for noticing, because I am still speak fast, but there's a calmness that is unexplainable that happened because of this isolation.
Yeah, no, you only speak as fast as us Aussies now. Before, like a lot of Americans talk a lot slower than us. So no, you're just up to normal pace.
So I'm up to your standards. That's good.
Yeah, up to crazy standards. Well, James, thank you so much. I hope that people that are listening up to this recording will get loads and loads of great content. So we get onto your website, they can download the course. They can also get other online opportunities, or link up to when you're going to be around for 2021. Is that correct?
Yeah, I think it's going to be, I'm hoping 2021 or 22 back to Australia. And I am changing the time of my online webinars because it's in the middle of the night for Australia. Yeah. So in July, it's going to be about this time that I'll be teaching those. So if they do want to come on, we'll send you links. And since I can't come there for another year or two, which I'm regretting because I love that country so much.
Yeah, you definitely have to send me the new timelines, because the old ones were like people saying, really?
They were like 3 a.m. Australia time. I know, I'm so bad with that.
Well, I'm running courses with South Africa and India, and linking some of the ones for the UK and Ireland. and that's 4 p.m. my time, which is 8 a.m. South Africa, 9 a.m. India. So yeah, we have to be really mindful of what time we can run things that work for everybody. But James, thank you so much again. It's been an absolute pleasure talking to you. I love listening to you. You've got the greatest pearls of wisdom because you're evolving all the time.
Thanks, Paula. Paula, it's nice to, and maybe I'll spend more time with you when I get back to Australia, so we can actually get to know each other better. Now that I'm calmer.
But not on Valentine's Day. My partner Ian would be mortified.
Special guy wouldn't probably approve of that. Luckily David had no choice. He posted me in Bali. So.
Exactly. All right. Thanks again, James.
All right. Thanks, Paula. God bless. Have a great evening.
Thank you.